Sexual health is about knowledge, empowerment, and taking control of your body and your future. It's not about shame or judgment. It's about making sure you're informed, proactive, and safe. When we talk about same gender sexual experiences, particularly between men, there are unique health considerations that need to be acknowledged honestly and compassionately. These conversations can literally be life-saving. One of the most critical concerns is the increased risk of HIV. Receptive anal intercourse carries a higher rate of transmission than many other forms of sexual activity due to the fragility of rectal tissue, which can make it easier for the virus to enter the bloodstream. HIV isn't a death sentence like it once was, but it's still a life-changing diagnosis that requires lifelong medication and lifestyle adjustments. Regular testing, condom use, and considering preventive tools like PrEP pre-exposure prophylaxis can dramatically reduce the risk. But the first step is simply knowing your status and being aware of your partners. Another major concern is hepatitis B and C. Both are viruses that affect the liver, and both can be transmitted through sexual contact, especially if there's exposure to blood or open sores. Hepatitis B is vaccine preventable, which is an essential part of sexual health for anyone who's sexually active, regardless of gender or orientation. Hepatitis C, however, doesn't have a vaccine and can become a silent killer if left undiagnosed. Many people live with it for years without symptoms until liver damage is significant. That's why routine screening is so important, especially if you've had unprotected sex, multiple partners, or any history of drug use. And we can't overlook syphilis. This bacterial infection has been making a concerning comeback, particularly among men who have sex with men. It often starts with a painless sore that can go unnoticed, and without treatment, it progresses to affect the skin, brain, heart, and other organs. What's terrifying is how easily it can be missed, and how devastating the late stages can be. Fortunately, syphilis is curable with antibiotics, but only if it's caught in time. Being honest with yourself about your experiences is not weakness. It's strength. You deserve to be healthy, safe, and fully informed. Your history doesn't define you, but your choices moving forward absolutely can empower you. When we talk about HIV, it's important to understand that this virus doesn't discriminate. But certain behaviors can increase your risk of exposure. For men who have sex with men, the risk is significantly higher, especially when engaging in receptive anal intercourse. This isn't about stigmatizing behavior. It's about the biology of how the virus is transmitted. The lining of the rectum is delicate and prone to microtears, which can allow the virus to enter the bloodstream much more easily than through other forms of sexual contact. That's why understanding the mechanics of transmission is so crucial when making decisions about your sexual health. But the good news is that we are no longer in the early days of the HIV epidemic. We now have powerful tools that can protect you, but part of regular HIV testing is essential, not just for your own peace of mind, but also as a responsible way to care for your partners. Knowing your status is the foundation of safe sexual relationships. It allows you to make informed decisions and, if necessary, begin treatment early, which can reduce your viral load to undetectable levels, meaning the virus cannot be transmitted to others. That's a game changer. We also have PrEP, pre-exposure prophylaxis, which is a daily pill or long-acting injection that dramatically reduces your risk of contracting HIV. When taken consistently, PrEP has been shown to be more than 99% effective at preventing HIV transmission through sex. It's one of the most powerful tools available, but many people either don't know about it or feel uncomfortable asking their doctor. We have to remove the shame from these conversations. Asking about prevention isn't an admission of guilt. It's an act of courage and care. Condoms, though sometimes seen as old school, still provide a strong layer of protection, not only against HIV but also other sexually transmitted infections. Used properly and consistently, they can greatly reduce your risk. And communication with your partner matters. Being open about your history, your health, and your expectations creates a space for trust and safety. You deserve to feel safe and supported in your sexuality. Protecting yourself from HIV isn't about fear. It's about self-love, responsibility, and empowerment. But with the right tools and mindset, you can enjoy intimacy without sacrificing your health or peace of mind. Hepatitis B and C are serious viral infections that primarily affect the liver, and both can be transmitted through sexual contact, especially in situations involving blood, open sores, or bodily fluids. Men who have sex with men are at a higher risk for these infections, not because of who they are, but because of how these viruses spread. What makes hepatitis especially concerning is that it often remains silent. There are typically no obvious symptoms in the early stages. Many people carry the virus without knowing it, sometimes for years, until it causes significant liver damage. Hepatitis B is the more easily transmissible of the two through sexual activity. Fortunately, there's a highly effective vaccine that offers long-term protection. It's part of routine childhood immunizations in many countries, but not everyone has received it, especially adults. If you haven't been vaccinated, this is a simple and important step you can take to protect your liver and your future. A quick blood test can determine if you're immune, and if you're not, getting the vaccine series is safe, easy, and widely available. Hepatitis C, on the other hand, is not vaccine preventable and often flies under the radar. It's primarily spread through blood-to-blood contact, but it can also be transmitted sexually, especially in cases of rough or unprotected anal sex, the presence of other STIs, or sharing of sex toys without proper cleaning. Because it can take years before symptoms appear, many people don't realize they've been infected until a routine blood test reveals abnormal liver function, or until advanced damage has occurred. Left untreated, hepatitis C can lead to cirrhosis, liver failure, or even liver cancer. The positive news is that today, hepatitis C is curable with a short course of antiviral medication, often requiring just 8 to 12 weeks of treatment. Early detection is key. This is why routine liver function tests and hepatitis screening should be part of your regular sexual health checkups if you're sexually active, particularly with multiple partners or high-risk behaviors. Caring for your liver is just as important as protecting any other part of your body. Making these health screenings part of your regular routine is not just smart. It's a deeply empowering act of self-care that reflects your commitment to your long-term well-being. Syphilis is a sexually transmitted infection that has seen a troubling resurgence in recent years, particularly among men who have sex with men. Once thought to be almost eradicated, awareness and action are at the heart of protecting your sexual health. Too often, conversations about sexual behavior are wrapped in silence, discomfort, or stigma, especially when they involve experiences that don't fit into traditional norms. But knowledge is power, and taking ownership of your health begins with honesty. That doesn't mean you have to share your entire history with the world, but you do owe it to yourself to be truthful with your healthcare provider and, more importantly, with yourself. If you've had sex with another man, even once, it's relevant to your health. That one experience can change your risk profile and determine what kinds of screenings or preventive care you need. One of the most common barriers to good sexual health is fear. Fear of judgment, fear of diagnosis, or fear of what it might mean for your identity. But fear doesn't protect you. Information does. When you get tested regularly, know your status, ask questions, and advocate for your health, you're giving yourself the chance to live fully and safely. Sexual activity isn't inherently dangerous, but ignoring the reality of risks and skipping care out of shame or discomfort can lead to devastating outcomes. You don't need to navigate this alone. Sexual health clinics, online resources, and supportive medical professionals exist to guide you through these decisions without shame. Whether it's asking for an HIV test, getting vaccinated for hepatitis B, screening for STs like syphilis, or talking about PrEP, these are responsible, empowered choices. They reflect strength, not weakness. They show that you care about your future, your partners, and your well-being. Being informed also means setting boundaries and making decisions that align with your values and comfort level. You are in charge of your body. You deserve to understand the risks, know your options, and access care that supports your needs without judgment. Awareness isn't just about recognizing danger. It's about stepping into your power, making thoughtful choices, and refusing to let silence or fear dictate your health. Your past doesn't define you, but your willingness to act in the present will shape your future. When you take responsibility for your sexual health, you're not just protecting yourself, you're creating space for safer, healthier, and more meaningful connections with others. Your sexual health is not something to ignore, fear, or feel ashamed of. It's something to understand, respect, and protect. Whether your experiences are part of your past or present, what matters most is how you choose to care for yourself now. HIV, hepatitis B and C, and syphilis are serious conditions, but they're also manageable, preventable, and in some cases, curable. When you stay informed, get tested regularly, use protection, and speak openly with healthcare providers, you are claiming authority over your health and your life. You are not defined by your choices. You are empowered by the actions you take from this moment forward. Take care of yourself because you are worth it.